Good morning, class. Our topic for today is cystic fibrosis. Cystic fibrosis is a disease of exocrine gland function that involves multiple organ systems but chiefly results in chronic respiratory infections, pancreatic enzyme insufficiency. Cystic fibrosis is an autosomal recessive disorder, and most carriers of the gene are symptomatic. It is progressive and incurable.
Okay, for pathophysiology of cystic fibrosis. Cystic fibrosis is a respiratory disorder that results from inheriting a mutated gene from both parents. It is characterized by mucus glands that secrete an increase in the quantity of thick, tenacious mucus, which leads to the following. Mechanical obstruction of organs, for example, organs that get obstructed are the pancreas, lungs, liver, small intestine, and reproductive system. An increase in organic and enzymatic constituents in the saliva, which is heightened activity of the salivary glands with an increased sodium and chloride content of sweat as well. An increase in the sodium and chloride content of sweat. Our sweat then becomes, with increased sodium and chloride content, our sweat then becomes a risk for dehydration. Autonomic nervous system abnormalities is a dysfunction in the involuntary nervous system that controls bodily functions like heart rate, sweating, digestion, and blood pressure. Some of the lab tests and diagnostic procedures are, for labs, it would be blood for a nutritional panel, sputum cultures for detection of infection, DNA to isolate the mutation, and diagnostic procedures could be pulmonary function tests to evaluate the small airways. A chest x-ray can indicate diffused arteriosclerotic and obstructive emphysema, stool analysis for presence of fat and enzyme, and sweat chloride tests, which is a diagnosis that confirms cystic fibrosis. For medications, we have bronchodilators like albuterol, human deoxyribonuclease, Dornase alpha, and then antibiotics, pancreatic enzymes, vitamins and minerals, multivitamins, and laxatives or stool softeners.
So nursing interventions for cystic fibrosis, airway clearance. Regular airway clearance such as physiotherapy or vest therapy helps prevent mucus buildup in lungs. Exercise helps keep the lungs healthy and clear. Exercise and nutrition, encouraging high fiber foods and adequate fluid intake. Oxygen therapy, proper hand washing to prevent infection. Monitoring, assess skin condition around the rectum for irritation and breakdown from frequent fall stools. Relieving anxiety, helping coping with the anxiety related to hospitalization.
Our last slide is on manifestation of cystic fibrosis. Some manifestations are as follows. We have chronic cough, recurrent bronchitis, and pneumonia. We have wheezing and shortness of breath, coughing of blood, sinusitis, clubbing fingers and toes, and respiratory distress. Thank you.